Hello everyone and welcome to the HacettepePathology.com. So this month's case was a 30-year-old male with a retroperitoneal mass, and when you encounter a mass in a young man in his 30s, 20s, 30s and 40s, you should think about the germ cell metastasis, germ cell tumor metastasis. So the tumor was a biopsy, the core biopsy was 90% necrotic, and we only have small areas of cells there. They show this undifferentiated morphology, and let me show you this part here again. Some of them are dying, some of them are about to die. So we have this, and we ordered some stains like SAL4. SAL4 was positive here. And we did OC3-4, but this stain is affected by necrosis a lot. It doesn't stain anything. Cytokeratin seems to be preserved in the necrotic germ cell tumors also. So we have lots of keratin positivity also in the necrotic area, but non-necrotic cells were also positive. So we reported this as a possible germ cell tumor metastasis, possibly embryonal carcinoma, and they gave a chemotherapy first and then did the archiectomy later. Now I'm going to show you the archiectomy specimen, and here's the testis, and what we see is a large amount of proliferating cells, proliferating eosinophilic cells, just in between the seminiferous tubules. And that was kind of surprising to see. The whole parenchyma is showing this diffuse and a nodular proliferation, also involving the retatestis, and even they go to the surrounding paratesticular tissue. Actually, this was more worrisome, at least for me, because you have this likely involvement of the adipocytes and vasculature, and even we have nerve within this proliferation. But when you look at the cells are monotonous, and they are like Leydig cells, again, vessels and nerves. It's kind of a hematomatous structure to me. So, and even in the surgical margin of the spermatic cord, we see the same cells. So I would like to do the stains to show the origin of these cells, and this is calretinine, and it was positive for calretinine, which makes this sex cord lesion, sex cord stromal lesion, and this is again infibin, and these are Leydig cells. So I did sulfur, and sulfur was negative here. Only it highlighted the germ cells left in the tubuli. And I ordered it OCT43, and OCT43 was also positive. Here is the best area here, which makes these cells as a germ cell neoplasia in situ. And I just, of course, I was suspecting this because the seminiferous tubules were empty and certainly cell only, and I just couldn't realize. I mean, there are some cells maybe here, some suspicious cells, but here again. So these cells here again, these cells were positive for OCT3/4, and we didn't have any germ cell tumor left in the testis, but we have this Leydig cell proliferation, and I did a calretinin to the necrotic metastasis here, and calretinin was negative again, and then I did a cytokeratin to this Leydig cell tumor, because we have this proliferation even extending to the paratesticular and tissue and spermatic cord. So I wanted to be 100% sure that this is not that tumor, and then read some papers telling me that some Leydig cells can be ectopic. Leydig cells can be found in paratesticular and tissue and spermatic cord. So I ended up with a diagnosis of Leydig cell hyperplasia with some ectatic hyperplastic foci in the extratesticular tissue. Thank you very much, and I hope you enjoyed this.